Hello and welcome to your lecture. In this recording, we're going to go into part 2 of muscle identification. Remember, we're just doing a survey of muscles. You have a list, you have a corresponding list of muscles with origins and insertions. You have a quiz on origins and insertions of particular muscles that are related to a muscle activity that we did. But as I go through some of the identification, I will let you know what to focus on in relation to that. What we're going to do primarily is go through a select group of muscles to identify. So again, body has about 700 muscles. We're breaking it down to like 50. So for part of your online muscle practical, this will be relevant so that you can go through the pictures and identify them. For that online practical, there are 40 multiple choice questions. The entire thing is worth 20 points. So what we have in front of us here is the last of the grouping of head and neck, the splenius capitis muscle. We went through that if you look at part 1. So let's go into then shoulders and chest muscles. Let's go with this picture first, actually. So the trapezius muscle, located at the top of your shoulder, at the portion where the neck, your cervical spine meets your thoracic spine, and then over to the shoulder girdle. This muscle is the one that if you're a bodybuilder or you know a bodybuilder, oftentimes this is a very enhanced muscle that they work out and exercise heavily. The trapezius has the action of extending the head. It elevates, depresses, and adducts and stabilizes the scapula. And the reason that it's able to do that is because it originates on the occiput, the cervical and thoracic vertebra. So it takes up a large area of your back. These are superficial muscles. It inserts on the spine of the scapula as well as the clavicle. Now there are different parts and pieces to the the trapezius muscle itself, but this is it. And it kind of is in the shape of a kite, honestly, because it will attach to the head. It comes down at its points on the scapula and then will attach again on the vertebra. The next muscle on our list of muscles to identify is the rhomboid major. We also have a rhomboid minor. In this grouping, these are located between the spine and the shoulder blade on each side. The rhomboid minor is the smaller of the two muscles, and it is superior to the rhomboid major. This group of muscles has the job of retracting the scapula. It originates from vertebra T2 to T5 and inserts on the medial border of the scapula. The other muscle that we have, still classified as a superficial muscle, is the levator scapula. If you look at the word, hopefully it indicates to you that it will elevate the scapula, but it also retracts the scapula. In order to do that, it will originate from C1 to C4 and insert on the medial border of the scapula superior to the spine. The serratus anterior muscle let me find the picture where we can see that a lot better. Okay. Here we have a visual of the serratus anterior. When you look at a model of the spine, this is a jagged edged muscle, hence the name serratus. The serratus anterior muscle, you need to know this for your origin and insertion quiz. It has the job of holding the scapula against the chest wall, and it will help raise and adduct the arm. In order to be able to perform that action, it will originate from a series of muscles from ribs 1 through 8, and then it will insert on the vertebral border of the scapula. When we need to see the next muscle, Pectoralis Major, on this picture, you can see where it's located. Again, this is a common muscle for bodybuilders to work, which will give them an enhanced chest appearance, but it will also tend to roll their shoulders inward if it's not balanced with some posterior muscular work. The pectoralis major has the job of flexing and adducting the humerus. And in order to do that, it will originate on the sternum, the clavicle, and ribs 1 through 6. It needs to insert on the proximal humerus. If its job is to roll that humerus in, that's where it will insert. I hope that makes sense. And since we have a pectoralis major, we are going to have a pectoralis minor, which is in the other picture on the screen. The pectoralis major is one that you'll need to know for your origin and insertion quiz. It has the job of drawing the scapula forward and downward. In order to be able to do that, it must originate on the anterior surface of ribs 3 through 5, and it will insert on the coracoid process of the scap. Next, we have the teres major. The teres major has the job of extending and medially rotating the humerus, and it will work with the latissimus dorsi in the adduction of the humerus. In order to be able to perform this job, it will have to originate on the posterior scapula at the inferior angle and insert on the proximal humerus. So if you look at this picture here, let's look at both sides. We have superficial and then middle musculature evidenced here. In the superficial layer, you can still see the teres major muscle. It's going to be inferior to the teres minor as well as the infraspinatus muscle. So when we retract some groups back and we get into that middle layer, they can be more exposed. Again, teres major muscle will be the most inferior of the group that I just mentioned. Next is teres minor. This has the job of laterally rotating the arm and stabilizing the shoulder joint. The teres minor is part of the rotator cuff. It will originate on the lateral border of the dorsal scap and insert on the greater tubercle of the humerus. We've mentioned the latissimus dorsi. This extends and adducts the humerus. This is a superficial back muscle. It originates on the lower spine as well as the iliac crest. It will insert on the proximal humerus. This is a great example of how you're connecting points and parts of the body. This connects to the pelvis and the arm. If you have an issue in either place, you have an issue in the other place. If the musculature and the connective tissue is contracted or twisted, adhesed, anything like that. Next, we have the supraspinatus followed by the infraspinatus muscle. Both of these you will have to know for your quiz. Now, let me find the appropriate picture for the supraspinatus. So here we have on this picture the best example of the supraspinatus muscle. This is one of the muscles of the rotator cuff. The name should give you the indication that it sits above the scapular spine. The supraspinatus muscle has the role of initiating abduction, but it also, because it's part of that rotator cuff, will stabilize the shoulder. It originates on the supraspinous fossa and will insert on the greater tubercle of the humerus. When we have the infraspinatus muscle, hopefully that word will lead you to understand that it is below the spine of the scapula. It gets to adduct the arm and also rotate it laterally. It originates on the scap and inserts on the greater tubercle of the humerus. And the last of the shoulder and chest muscles belongs to the deltoid. The deltoid muscle is what will form the shoulder cap. So if you are into weightlifting, or maybe not, but you've ever seen someone with a highly defined shoulder muscle group, likely they've done a lot of deltoid work. This makes the shoulder look really nice and cut. It has the capacity to abduct the arm, and it does that because it originates on the spine of the scapula and the clavicle, and it will insert on the deltoid tuberosity of the humerus. Okay, short and sweet on that one. So we'll see in the part 3 of muscle identification.